Okay, in the last and final section of our lecture, now we will talk about the management of the vulvar cancer. In this management, we will talk about the pathology, management, and differential diagnosis, and then the treatment of the vulval cancer. Pathology, as you see in this, is the histological picture of vulval squamous cell carcinoma. We can clearly tell these are the squamous cells, but due to the changes as a result of the malignancy, there are dysplastic changes in the squamous cell of the vulva. So sites of vulval carcinoma, usually they are in the labia majora, clitoris, and labia minora. Naked eye is again the appearance with naked eye is ulcerative and hypertrophic. Hypertrophy, the excessive growth of the cell is present, and it is also ulcerative, or ulcer are present. Management is prophylactic. Prophylaxis or prophylactic is the management which is before the occurrence of the disease. So prophylactic management, and then we have definitive treatment. In definitive treatment, there is micro-invasive lesion, and then frank invasion. If there is frank invasion, treatment will be different, and then if it's micro invasion, then treatment will be different. Differential diagnosis of the vulval carcinoma is usually condyloma acuminata, syphilitic ulcer, tubercular ulcer, lymphogranuloma venereum. All these are the STDs except the tubercular ulcer, which is caused by tuberculosis, which spreads to different organs, including the female genital tract, condyloma acuminata, lymphogranuloma venereum, syphilis. All these are the different sexually transmitted infections. Then soft sore. Then what's the treatment of the vulval carcinoma? Vulval excision. These margins, these are the areas removed, and these are the lymph nodes removed as a result of the vulval malignancy. So the clitoris, then we have the opening for the bladder, vagina. Then in this, the vulva, the entire vulva is excised along with the lymph nodes, surrounding lymph nodes in both sides. Then another treatment is sentinel lymph node biopsy and groin lymphadenectomy. So these are all the lymph nodes, sentinel lymph nodes. These are biopsy is taken from the sentinel lymph nodes, and then they are sent for the examination. And also groin lymphadenectomy, lymph nodes which were present or which were involved in the vulvar carcinoma, groin lymph nodes, they are removed here from the groin. Radiotherapy is also performed, in which we have the adjuvant radiotherapy, which is indicated adjuvant radiotherapy when excision margins are close or involved in the presence of 2 or more groin node metastases. So adjuvant radiotherapy is important when the margins or the excised area is close and when there are lymph nodes involved in the groin region. In neoadjuvant radiotherapy, before surgery is usually done to shrink the tumor size. So once if the tumor is big enough, usually neoadjuvant radiotherapy is performed to shrink the size of the tumor so it can be removed easily. Then chemotherapy is also used as a treatment option associated with improved cure rate. So as with any malignancy, vulval malignancy, we said it is treated by surgery, and depending on the surgery, if it is less invasive or more invasive, usually vulva is removed and along with the lymph nodes in the inguinal region or in the groin region are removed. And then radiotherapy after the surgery is performed, especially when excision margins are close and when the lymph nodes are present in the groin. And neoadjuvant therapy is performed when before the surgery, in which they shrink the size of the tumor and it is easily removed. And chemotherapy is associated with improved cure rate. So that was all about the management of the vulval carcinoma. So in this lecture, we talked in detail about all the malignancies of the cervix, vulva, and vagina, how they present, how they are treated and diagnosed, and how they are managed, and what's the effect of staging on the prognosis of different malignancies. So thank you for watching sqadia.com.